Welcome, everyone. I am Margaret Brawley, the CEO of Medicines for Humanity. Thank you so much for joining us this morning. It is great to have so many people with us. We've had more than 80 people register for this virtual event. We are gratified to be able to share what's going on at some of our projects during this pandemic period of COVID-19 with you. And as the COVID threat's been developing, the MFH staff really sprang into action to make sure that our partners were fully aware of the ensuing crisis and would be prepared for it. And among NGOs, I am proud to tell you that MFH was part of that initial wave of first responders. We've been at this for 5 months now, and our efforts have not let up. MFH immediately sent personal protective equipment, supplies, and medicines to all of our projects. In most places, these are the only materials that our partners have received to date. And in some places, our partners were asked by local government health officials to share their COVID supplies, since they themselves had little other support. We developed informational posters and brochures to explain what COVID is and what precautions people need to take. These were translated and printed in 5 different languages. And we even produced animated educational videos to be shared as social media tools. And that was really done to help a lot of our community health workers be reached virtually, since we couldn't see them in person. In many countries, our educational materials and our COVID training curriculum were distributed widely, well beyond our project sites. In Zambia, our efforts led to radio broadcasts that were carried throughout the nation, and using radio was a first for us. We estimate that MFH has been responsible for reaching more than 5 million people with information about COVID and how to stay safe. And that's about 5 times the number of people we normally reach in 1 year. During this hour, we're going to take you to Haiti, the Dominican Republic, and Cameroon for a first-hand look at what life is like in these places under the COVID pandemic. As we visit each one, an MFH staffer will narrate the scenes and help you understand what you're looking at. So let's get started on our visit. First, I would like to introduce Kristen Fonfon, who's the MFH Program Manager for Latin American and the Caribbean. She's going to escort us on a visit to Haiti. Kristen, over to you.
Good morning. I'm happy to be taking on a visit to Haiti this morning and showing you what's happening there. The first case of COVID-19 was identified in Haiti on March 19, 2020. The number of cases began to increase sharply in June, and as of this week, there were approximately 7,300 confirmed cases throughout the country. However, there are challenges in determining whether this is the real number of cases in the country, since there are only 2 laboratories that are able to test for COVID cases. As you can see in this video, it's very difficult to follow social distancing guidelines in the communities we serve in Haiti. Communities are crowded in small areas, and there's limited access to clean water and hand washing stations throughout Haiti, which limits people's abilities to wash their hands frequently to prevent the spread of the virus. The majority of Haitians purchase food and goods in open public markets that are often crowded. As you can see here, there are many people selling or buying products and not wearing masks. Many families live with limited and sporadic access to electricity, so purchasing foods in bulk that can be kept refrigerated is nearly impossible. Families also don't have the funds to be able to purchase a large amount of food at one time, but rather purchase small amounts daily or every few days. What you're seeing now is the traditional mode of transportation in this area, called tap-taps. Tap-taps are packed with people traveling to the city. Many of them are not wearing masks, and few changes have been made to limit the amount of riders. Now we're going to visit our clinic in Grand Boulange. You can see right away the drastic difference in safety measures inside the clinic. The staff have personal protective equipment, including face masks, face shields, gloves, and coats and gowns. Here you can see a staff member using a new thermal thermometer to take the temperature of a patient and limit the contact between patients and providers. We're also limiting the number of patients that can enter, so the waiting rooms are not crowded. Patients are required to wash their hands before entering the clinic and required to wear a face mask while in the clinic. Here you're seeing a consultation for medication. These are limited to the patient and the caregiver in the case of a child or person who needs assistance. MFH has been working with our partners across the country to provide COVID-related health education, like the posters you see here. These posters were translated into Creole and printed and hung around the clinics, and brochures were distributed to patients and people in the community. They're also made available to other organizations that want to use them. They feature information on COVID prevention, symptoms, and proper mask use. We have also purchased cleaning supplies, soap, hand washing stations, and medications. We've reached 21 partners across the country, most of whom are congregations of Catholic sisters. Since March, we have donated over 8,500 bottles of medication, approximately 8,000 containers of soap, personal protective equipment, and cleaning materials, and educational material for over 75,000 households, thanks to donations from various donors and foundations. Dusan St. Jean is our country coordinator in Haiti, and he's on the call with us this morning from Port-au-Prince. So Dusan is going to share a story with us about some of the experiences there in Haiti. Dusan, over to you.
Before Dusan gets started, just to interrupt, I'm sorry, Dusan. I know a few people have had problems hearing sound on the video. On our end, everything seems to be working appropriately. So for those folks that may be having a few problems, I suggest maybe logging off and coming back in and see if that corrects it. All right, thanks, Dusan. Back to you.
Thank you, Margaret, and good morning, everyone. I would like to share with you a little story about Haiti, and in fact, this is an ongoing story. This is related to the new coronavirus here in Haiti. Many people are afraid to go to hospital when they have signs or symptoms related to the COVID-19. They firstly think if they go to the hospital, they will get worse or die. Some of them don't even want to call an health official to get tested because they're afraid during the testing procedure they will get infected by the virus. So when they see a condition is getting worse and decided to go to the hospital, sometimes it is too late and they die shortly after admitted to the hospital. Our health partners and community health workers are encouraging the people to know the signs and symptoms related to COVID-19 and how to prevent infection, and when it is necessary to go to a health facility. So that we not lose many lives that should have been prevented. So that is the end of our story here, and I'm waiting to see if there is any question.
Thanks so much, Dusan, for sharing some of those insights. I'll just remind everyone, in case some joined late, that we're taking questions through the question box, and you can type it in there. Because we have so many people with us today, we're not able to take them verbally, but I am monitoring questions and we'll share them with Dusan. So one question has come through, Dusan. What's been the government response to COVID? And is the government supporting health facilities?
What now? The government is only supporting the public institution, the public health institution. They do not give help to the private institution. And they also put a lot of funds to advertising against the propagation of the virus through radio and TV and social medias. And then they have only 2 facilities where they are taking care of the COVID confirmed cases throughout the nation.
Okay, and then I've got another question from someone asking about how many cases of COVID we've seen in some of the MFH clinics. Can you talk about that?
In the clinic we support here, we receive many cases with, suspect cases with signs or symptoms related to COVID-19. And generally, we treat those signs or symptoms and we refer the patient to the health facility where they have the testing capacity. Unfortunately, our clinic that we currently support don't have the testing a kit or capacity. So that's why we don't know the coughing cases that we are serving.
Hmm. And someone else noted that in the video, not a lot of people are wearing masks. Maybe you could talk a little bit about why that's happening in Haiti and what are the reasons for that?
Many people still don't realize the importance of wearing a mask. They don't know the importance and then they don't wear it. But many of them know the importance, but they just don't wear it because they say when they wear it, it prevents them from breathing well. So they have difficulty of breathing or talking. They think people will not hear very well what they are saying. That's why they don't wear it.
Okay, all right. Well, thanks very much, Dusan, for sharing some of those insights.